being on social media, right, and sharing your expertise, what does that mean to be out there as a health professional in the social media setting?
Well, I think everyone first shares the passion of wanting to educate their patients and the public, right? We all want patients to do well. When you get into media, it gets a little bit tricky, right? Because we're all concerned about that one soundbite where you didn't say something correctly and it goes viral. And this is a very slippery slope. Just as much as you've trained to become a physician, nurse practitioner, midwife, there are elements. Because of all that knowledge and training you have, it's important that we can articulate this properly. Now, in a setting where it's recorded or you may not have as much control of how far the message goes, it's very important to.
Hi, everyone. This is Theo Harvey once again, super excited about another podcast on medical success secrets. And I have a special guest today. I'm super excited to welcome Nurse Alice Benjamin. Nurse Alice, how are you today?
I'm doing well. Thank you for having me.
Awesome. If you guys don't know who Nurse Alice is, Alice has been a healthcare professional for over 25 years. She is a nurse, MSN, ACNS, BC, a family nurse practitioner. She has experience covering cardiovascular care, critical care, emergency medicine, advanced practice nursing. She has really been focused on like hospital patient safety, critical care education, and clinical mentor to tons of nurses out there over the years. But really, what gets me excited about what Nurse Alice has been doing is her focus in social media and putting her expertise out there. If you haven't heard of her website, asknursealice.com, it's a trusted health and wellness resource. And MediaRx is a media training firm for healthcare professionals. Her work as a TV medical correspondent and podcast host has made her a go-to expert in translating complex medical topics into relatable, actionable insights for patients and healthcare professionals alike. One of the things I'm really excited about her mantra is like, I like to talk to people before they became my patients. And that is so key. So Nurse Alice, thank you so much for joining us today.
Thanks for having me. You know, when I hear an introduction, I'm like, oh my gosh, is that me? But you know what, when you're passionate about the work that you do, you just don't even think of those things. You just go, go, go. So yeah, I'm excited to be here. Thanks for having me.
Absolutely. So, one of the things that we talk about in this podcast is the evolving nature of what it means to become a healthcare professional, right? In this new era of healthcare. And with your several years of experience in healthcare, how do you see the role of nurses evolving in the future, especially with increasing complexity of patient care now?
Well, I have seen actually the nurse's role evolve tremendously already. Now, I have about 25 years in the game. And so I'm still young, y'all. I'm still young. I'm a nurse, born a nurse. But from looking back at when I first entered nursing and the structure, the processes, the scope of practice, if you will, and then to where we are today, I have to say it's very exciting times. But to whom much is given, much is required. So while as a nurse, and for those who are listening, there are various entry levels for nursing. So when we say nursing, it can be sometimes confusing because there is a licensed practical nurse, there is a registered nurse, there is an advanced practice nurse, which is our mid-level providers. That's the nurse practitioner, clinical nurse specialist, nurse anesthetist, and nurse midwife. And so what we're doing is, especially after the Affordable Care Act, I know there's been lots of changes and things rumbling around that, but the bottom line is we still have millions and millions of people who need care and there aren't enough providers. So as advanced practice nurses, we have really been able to step up to the plate to help our physician colleagues manage the millions of people out there with care. And now when you bring on technology, new devices, remote telehealth, and all of the fancy things that we can do thanks to technology, it really expands our reach and it makes accessing healthcare and delivering healthcare actually easier to patients, especially in those remote, tough to reach areas. And then we also, let's be honest, we have patients who they work 8 to 5, they work banker's hours. They can't afford to take a full day off of work to go to an appointment. So now we can visit with them remotely. We can monitor labs and a lot of other things remotely. And we have AI to help us as providers actually be more efficient with the work and care that we provide patients. So I'm excited about what's on the horizon with healthcare.
Well, you hit the nail on the head, telehealth, right? Prior to COVID, right, there was sparse use of it, right? It was maybe rural areas, things of that nature. But after COVID, right, and especially during COVID, we saw the rise of that. And I know you kind of practice in some of those areas. So talk to me a little bit about how does patient care change when you're delivering it remotely via technology?
So let me say this. So I historically have been in the hospital, critical care, ICU, cardiovascular care, and then emergency medicine, right? And much of that requires the patient to be there for us to see. And those are usually high acuity situations where the patient and the person is in our care. What I saw with COVID, and it was interesting because I was right in the middle of it. We were all learning COVID
Mhm.
at the same time. In addition to doing critical care and ER work, I actually took on some of the new work that came with COVID. So I actually helped to manage a federal COVID testing and vaccine site. And so I managed a team at a federal COVID testing site. And we had people coming in, but again, we're supposed to be social distancing and trying to minimize crowds. So much of the work we were able to do, the process we set in place where someone collects their specimen, submits it, and then goes home, where then myself and my team of providers would remotely talk to the patient through their phone, their computer, talking to them about the results, providing education, and if needed or warranted, offer any type of prescription, e-prescribe. And so the patient could then get their medication. So it really helped us to be more efficient with how we deliver care and actually safer with how we delivered care. So that was actually my first experience with telehealth during COVID. And now, even coming out of COVID, I still, although I'm still in the hospital, I still do family practice internal medicine. And much of that work is done remotely. I cannot emphasize how easier the process is for many patients. Now, some people still struggle, especially our elderly
Yep.
patients who maybe they weren't born with a cell phone. Like my son, I swear he was born with a cell phone in his hand, right? But once we get that structure set up, I'm able to, interact with my patients more real time, if you will. Things that we couldn't initially do because you had to come in and make an appointment, and that was always a
Mhm.
struggle. So now I'm able to communicate, get updates from my patients. Once their results are available, I'm able to see them. They're able to see them. We can have that discussion. Maybe it's a quick message like, okay, Nurse Alice, I see it. Thanks so much. I see they're normal. I'll follow up with you next year. Or if there's a question, maybe the patient came in and they just have a quick follow-up question. Doesn't require a full visit, and they can send me a message, or we need to pop on to a telehealth visit. I can. And it's just, it makes it more, I believe it's built trust, support, and community, also with helping to ensure that our patients can get care sooner. So it's no, and I've been a victim of this too, because although a provider, I'm a patient, you get the test results like, oh well, the next available appointment is in 2 months. You're just like,
Mm.
2 months. This lab's abnormal. What does it mean? This type of things. So now being able to do telehealth and all of these other things, we've expanded our care team at work we have providers who are strictly remote who can accommodate people. So I'm actually really excited. It's changed a lot of things. And I'm not only talking the talk, but I'm walking the walk as a provider and also a patient.
Oh, no, I love that. I agree. I think telehealth has changed, how I correspond with physicians as well. You're right. Lab results are just quick updates on what do they mean, just explanations, because, you're a trusted source of as a clinical professional. And as a patient, I'm always looking for that advice. And so if I can have that connection to you, that's so important because talk about the three T's, right? Trust, be able to be transparent with the patient, right? And then give your testimony. Why is it important to kind of speak on why it's important to share what you have with that patient? So I agree. Telehealth does enable a lot of that to your point, and I think more people are getting used to it as we kind of evolve into this new area of healthcare. When you kind of think of chronic conditions, heart disease is a huge problem. We talk about that a lot on this podcast. A lot of medical professionals work with patients who have uncontrollable hypertension. What do you think can be done better to educate the public about prevention, especially in underserved communities?
Well, that's my life work. I just have to emphasize that's the reason why I became a nurse, because my dad, retired service member, retired Navy, even though he had insurance, our community hospital wasn't as resourceful as some of the other places. And we saw lots of gaps in his care, in the
Mhm.
education, the outreach, the follow up. And back then, you had to come in for your appointment. They didn't have telehealth then, right? And then you always did what the doctor said, never asked any questions, because that's the generation my father grew up in. He died in the emergency room of sudden cardiac arrest. He was unmonitored. He was considered a frequent flyer. And we know sometimes that providers can become complacent, and the ER can be a unpredictable place. But because of the gaps in care, I decided that I was going to become the best cardiac nurse in the world. And my life work's mission has been with the American Heart Association. I've been a national spokesperson for them. I've represented them in the White House. under President Obama's administration for the Preventative Cardiovascular Task Force. I've worked with numerous organizations, anyone who have any church, school, your job, anyone who wants to hear about heart disease, I've provided education. And historically, that's been in person. So now we're able to do things like with Zoom, with social media, and reach out and educate people in other creative ways. And I encourage providers to do that. Now, in the hospital setting, also, I'll say this, as a medical correspondent for NBC, I have the opportunity to use that. So I'm very much on the bandwagon of mass communication, social media, technology. Some of my colleagues are still slow to get there, right? And understandably so. Things can go viral very quickly, especially the wrong things. But what I try to encourage my colleagues to do is to get on that same bandwagon with how they communicate with patients. But to get back to heart failure, because my dad died of sudden cardiac arrest, he also had hypertension, congestive heart failure, all of those things. I have done, this is back now, I'm going to maybe date myself, but I don't know if you remember when heart failure bundles, heart failure readmission rates, all those things started about insurance. I was there. I was on the forefront. I was one of the hospitals that helped piloted some of these bundles and helped to encourage remote monitoring of your weight, your O2 sat, how are you feeling? So patients can be monitored. And I wish that service had been available to my dad, because maybe, things might have turned out differently. So I'm very much a proponent of that. We have to educate, because we as healthcare providers, we can manage and we can treat things, but when the patient goes home, there's that gap. They have their primary care provider, but still we need to support our patient in as many ways as possible so they can have the best outcomes possible. And in doing that, and this is now for my colleagues, we actually reduce our workload by getting on the preventative side. And I quote me if I miss this, but I understand 2/3 of our healthcare dollars spent on chronic diseases. So if we can swing that pendulum, we could actually make the healthcare dollar go a lot further, last a lot longer. Because how spending is happening now, it's very expensive. Things are getting out of control. And as we as healthcare providers, with educating, empowering our patients, taking care of those, what can be subtle little changes can make a big difference in someone's life. And so I work a lot on those type of things.
Absolutely. And as a company that focuses in this space, we work with tens of thousands of patients in rural areas and underserved areas. And you're right. I mean, having a blood pressure monitor that can just keep them alerted to what the blood pressure looks like, or a continuous glucose monitor to just see the glucose levels, right? If they spike up after that extra piece of pie, right? During Christmas or Thanksgiving, that changes behavior, right? And those little things, add up over time and said, okay, maybe I can control this a little bit better, right? And then to your point, healthcare sees it, the CMS, obviously HEDIS measurements, quality measurements are a big piece of this. And so they have looked at hypertension, diabetes monitoring, right? Those are triple weighted. So if you can get people for glucose under 9% A1C, then that's a better quality measurement, right, for a health plan or a health organization. Likewise, hypertension, looking for under 140 over 90. And so those are the things, the healthcare systems, to your point, and see that these are like kind of canary in coal mines, uncontrollable hypertension, diabetes or pre-diabetes that can help, prevent patients from going into any kind of conditions. And to your point, I have you to thank, right? All these CPT codes that you're leveraging so that this can be, because unfortunately, healthcare is a business, right? And so, yes, we want to take care of the patients, but if it's not a sustainable model, it's hard to kind of, deliver these at scale. But now that we have CPT codes that can take advantage of this, we can do remote patient monitoring and chronic care management at a distance to help patients. I'm glad that you were at the forefront of that and saw that need and kind of put it out there. And I'm sure there was tons of meetings and conversations, and you know how healthcare is. Everyone gets together and have tons of meetings, and eventually things change over time. So I appreciate that. Let's pivot a little bit. You kind of mentioned a little bit like being on social media, right? And sharing your expertise. You said some of your colleagues are resistant to that. Some of the doctors I talk on this, or healthcare professionals, have a huge media presence, some not at all. But I'm just curious, what are your thoughts about like, what does that mean to be out there as a health professional in the social media setting? How do you, if someone's just dipping their toe, like we talked to a lot of healthcare professionals, what do you recommend to them? I'm sure they would ask you for advice. What do you recommend to them if they're just getting started, to put themselves out there on social media and share their expertise?
Right. Well, I think everyone first shares the passion of wanting to educate their patients and the public, right? We all want patients to do well. When you get into media, it gets a little bit tricky, right? Because we're all concerned about that one sound bite where you didn't say something correctly and it goes viral. And also, and this is a very slippery slope. So I will say this, just as much as you've trained to become a physician, nurse practitioner, midwife, there are elements because of all that knowledge and training you have. It's important that we can articulate this properly. Now, in a setting where it's recorded or you may not have as much control of how far the message goes, it's very important to make sure you're as prepared as possible. So I always encourage people, you got to do an in-service. You got to do some classes, something. I mean, as eloquent as you can speak in an academic symposium, that's one thing. But when you're in social media space, the public can be less forgiving because there's an element of this where, because we've not established a patient-provider relationship, this is informational use only, education purpose only. Now, we know that healthcare is not entertainment, but in that setting, because there's no relationship, it is. It's just, so I always make sure when I'm talking about whether it's heart disease, weight loss, diabetes, I will speak about it generally, maybe reference hypocompliant of some things that I commonly see in practice, but I'll always say, but make sure you follow up with your healthcare provider. So there's some staple things that you should do, but for people who don't know, I always encourage them, take a workshop, take a class on how to become more savvy in social media, or whether that's in writing, because, you have like your popular, I know they're your academic journals, but you have like your Essence magazine, your Ebony, your Black Enterprise, and other Huffington Posts. You can write for those as well, as I consider that media. And then there's television, radio, and podcasts, which, by the way, Theo, is exactly why I came up with the MediaRx.com. It is a mass communications platform that actually provides PR and media training for healthcare professionals, because we walk a very fine line, and we have to make sure that we're seen as objective and what we're saying is evidence-based, and that we're delivering very succinct bullet points in a short amount of time. So it takes practice. So I would say in-service, get some education. Hey, come to MediaRx.com, get some training, and then you just got to do it. You got to get in front of your phone and just practice and just get it out there. But I would encourage people to do it, because if you don't do it, you're going to get left behind, because this is how our patients are getting information. They would go online and Google things, which they still do, but they're going to TikTok, they're going to Instagram, and they're looking at the people talking to them, because that's what they want. They want someone to talk to them, explain something to them. So when we don't have that time in the office or during our visits, people are going here to social media and getting a kind of a continuation of information. So providers should do it. Hospitals, get on board. There's some policies and some guidelines when it comes to hospital brands and things like that. So just make sure you check with your hospital facility policy, get some training, and just get out there.
Absolutely. I mean, you hit the nail on the head. I mean, obviously during COVID, there was a lot of misinformation going out there. And so, I think healthcare professionals got to realize you're the expert, the expertise is there. And so, I think it starts with the intention. If your intention is to do no harm, right,
Mhm.
then go out there and start, like you said, baby steps, right? So that's one thing. And to your point, get the training you need. Like you mentioned, Media RX, definitely. We'll put a link in the show notes, but I absolutely encourage anyone, especially healthcare professionals, to kind of do that, because this is the new way. We're seeing the advent of, we didn't really talk about too much on this pod, but we've talked in previous podcasts about AI, artificial intelligence, is taking all this information and kind of remixing it. And so you want to make sure if you're out there communicating, you have the right information, but more importantly, you're making sure that if the AI is searching for quality information, you're going to find out searches are no longer using, Google searches, they're using AI, and that they're sourcing it from your content potentially. And so things like that is becoming more and more important as we look at where, healthcare is going. And obviously misinformation and changes, having someone who kind of knows what they're speaking about will eventually bubble up. I think, what's that saying? It says a lie goes around the world twice before the truth even puts its shoes on, right? And so
Right.
eventually the truth will pop up, but like to your point, just being consistent and be dedicated and have an intentionality around it. And I like your quote. Your quote was spot on. I like to talk to people before they become my patients. And I think that is so key. I don't know if you know Dr. Jane Morgan. She was on this podcast. She did like the Stairwell Chronicles, where she spoke about, just from her stairwell, talking about, things to do to help during COVID, right? To kind of, stay helpful. Dr. Refi, he was a pulmonologist. He did some breathing exercises people can do right during COVID to help them. And so, we're seeing more and more healthcare professionals putting their expertise out there, helping patients before they become their patients. And I think that's that's super, super great. So, wow, this is really insightful. There's Alice. So ingrained in like, different healthcare professionals. Definitely when you kind of look at where you see the future going for the brand of technology and integrating it into kind of what you're doing. I mean, you're in the forefront, talking to the media and things of that nature. What are some of the three things that you're kind of communicating over and over again, ensuring that, the public's aware of what they need to do to stay healthy, but more importantly, stay wise about what's changing in healthcare? I mean, what are some of the themes that you always come back to again and again?
Well, one of the things I always, regardless which topic we're talking about, is making sure that they're using an accurate source, because it's a double-edged sword. As wonderful and powerful and helpful as AI can be, we use Epic for charting. There's AI information that helps us with our work, but outside of your healthcare provider, wherever you are consuming information, make sure that you can always identify the original source of the information, because it's like the telephone game. Someone says something and then someone just repeats it, and then the message changes. So I always tell viewers, listeners, patients, make sure that you validate the source of where the information is coming from. Make sure it's coming from a credible healthcare professional, evidence-based. And so I've talked about that. But I think, you know what, there's so many things that are talking about, and healthcare is arguably the largest industry, right? Everyone is touched by health from the day you're born to the day you die, and everything in between. Somewhere, somehow, you interact with the healthcare system, you get healthcare somehow, some way. And with the current climate, especially, we just had a presidential election. So many things around healthcare have been politicized, and patients are so worried about what's going to happen for the future. And we just try to ground them in, I try to ground them in what's going on today, because everyone's concerned that they're not going to have healthcare. I think that's a big that's a big thing. Healthcare insurance. So while I, as a healthcare provider, yes, I talk about, like I said, diabetes, weight loss, and those, nutrition and fitness and the things that you can physically happen to your body. I make sure that I always incorporate the mental health of it, because there's a lot of things that are stressful in society today. And I always make sure I have a conversation about access to health, because that's important too. Because you can know a lot of things, but if you don't have access to your healthcare provider system or to those services, things can be stunted, and that's even more stressful. But access to healthcare, mental health, and making sure that they validate the information that they're receiving. They're not at the forefront where we're diet, exercise, like those are the most obvious things. But we as healthcare professionals also have to realize what are some of the other things that are hindering our patients from actually getting the care, doing the things that they want to do so they can be healthy.
Yeah, I think that's so key. I mean, if you're listening to, the wrong folks, you're not validating, what they're saying or their expertise in this area,
Yeah.
then, you could be led astray, right? And that's unfortunate. And to your point, understanding access. I mean, we just had a tragedy in New York, right? Where, a healthcare professional was, tragically pretty hurt, because people felt there was issues with, insurance access to, payments, helping to pay for healthcare. And so, hopefully, we won't see those type of things, emerge. But I think you're right, that mental health component, right, can kind of help people kind of understand, there's other things going on to
Mhm.
kind of keep them at ease and not having so much anxiety around these things that can do harm for them long term. So I agree. Those 3 points are spot on in the time that we live in, right? And so, wow, this has been awesome. Thank you so much for just talking to us about what you're doing out there, but also just listening to patients. I'm sure you speak to different people all the time, and they give you some of their stories, and definitely you're helping them and guiding them before they become your patient, which I love. Where can people find you, and what are you up to next?
Yes. So, anyone can follow me on all things social at Ask Nurse Alice, and my website is asknursealice.com. And I'm really excited moving forward, because I'm moving more towards an editorial base. So, really wanting to provide a lot of information for patients and the public. So, I actually have a team of writers who's going to be joining me. So, we're going to really push that and ramp that up, because I really like to sincerely want people to just have access to information. For so long, we've said knowledge is power, and it is. So I'm the website asknursealice.com. So I'm there. I'm also on NBC. So if you're ever watching television, NBC Los Angeles Channel 4 here. And then what else? I have a podcast, Ask Nurse Alice podcast. And then for healthcare professionals who are interested in optimizing their presence in media so they can help educate the public, help shape healthcare policy, and public perception. I have the Media RX. So I'm available. I know it doesn't seem like there's enough hours in the day, but when you really love and enjoy what you're doing, it doesn't seem like work, Theo. I just love what I do. And sometimes I'm like, wow, I get to do this. So I love it.
And this is in addition to your day job, right? Taking care of the
This is
patients.
the day job, right?
Well, I love that. Well, thank you, Nurse Alice, for your time. Really appreciate it. Everyone, thank you for listening. Hopefully you got some great information about what's happening and new changes in healthcare. Definitely, if you like what you're hearing, please subscribe and continue to listen as we help you navigate the new normal. Thank you again, Nurse Alice.
Thank you.